Listen carefully. If you're in your 70s and your doctor just gave you a high five because your blood pressure finally dropped to 120 over 80, what I'm about to tell you might save your life. Or at the very least, it could prevent a devastating fall that changes everything. There's a massive study that tracked over 15,000 seniors for half a decade, and the results are so surprising, so counterintuitive, that most physicians still don't know about them. In fact, what this research revealed completely flips conventional wisdom on its head. The seniors who achieved that so-called perfect blood pressure reading, the gold standard number we've been chasing for decades, they actually had a 28% higher risk of serious falls. And here's the part that shocked the medical community. Their overall mortality rates were worse than people with moderately higher numbers. I know that sounds impossible. I know it contradicts everything you've been told. But stay with me because in the next 15 minutes, I'm going to walk you through exactly why this happens, what blood pressure range is actually associated with the longest lifespan in older adults, and a simple test you can perform at home tonight that could literally prevent you from ending up in the emergency room with a broken hip. My name is Dr. Adri, and I've spent decades studying cardiovascular health in aging populations. And I can tell you with absolute certainty that the information I'm about to share could genuinely change your life or the life of someone you love. Before we go any further, do me a quick favor. Drop a comment right now with just your age. That's all. Just your age. I need to see who's watching this because what I'm about to explain applies very differently depending on whether you're 65, 75, or 85. And if you've ever felt dizzy or lightheaded when you stand up from a chair or get out of bed in the morning, add the word dizzy to your comment. This is critical. You'll understand why in just a few minutes. And if you value this kind of real, research-backed information that could actually protect your health, hit that subscribe button right now and drop a comment letting me know where you're watching from. I release content like this every single week. No hype, no gimmicks. Just medical science explained in a way that makes sense. Now here's what's happening in doctors' offices everywhere, right at this very moment. A 78-year-old walks in for a routine checkup. Blood pressure reads 145 over 86. The doctor glances at the computer screen, sees the standard guideline target of less than 130 systolic, and immediately reaches for the prescription pad. One medication gets added, then another. Over the next few months, that blood pressure comes down beautifully, 124 over 78. The doctor smiles. The patient gets praised. Everyone thinks this is a victory. But here's what those guidelines don't account for. That same 78-year-old now stands up to use the bathroom in the middle of the night, and their blood pressure, which looked perfect sitting in the doctor's office, suddenly plummets from 124 over 78 down to 88 over 56 in a matter of seconds. Their brain isn't getting enough blood flow. The room starts spinning. They reach for the wall, but miss. And suddenly we're not talking about numbers on a chart anymore. We're talking about a fractured hip, emergency surgery, 3 weeks in rehab, and a cascade of complications that too often leads to loss of independence, or worse. The research I'm talking about was published just months ago in JAMA Internal Medicine. It should have made front-page news everywhere, but most doctors still haven't seen it. Most patients certainly have no idea it exists, and that gap between what the research shows and what's actually happening in everyday medical practice is quietly costing lives. Here's the part that's going to sound completely backward, and I need you to stick with me because this is where everything changes. For decades, we've been told the same thing over and over. Lower blood pressure equals better health. And for middle-aged people, folks in their 40s and 50s, that's largely accurate. Getting blood pressure under control in midlife absolutely prevents heart attacks, strokes, and kidney disease later on. The evidence is rock solid. But something fundamental shifts after age 75. The research clearly shows that seniors with systolic blood pressure between 130 and 145 actually live longer than those with pressure below 120. They have fewer falls, fewer fractures, fewer hospitalizations, and better brain function. The group that achieved that textbook perfect 120 over 80, they had significantly higher rates of dizziness, fainting, acute kidney problems, and yes, higher death rates. Now, if you're someone who wants to understand the why behind the numbers, not just be told what to do, then what I'm about to explain is going to give you a completely different way of thinking about blood pressure as you age. Your cardiovascular system at 75 is not just an older version of what it was at 45. It's fundamentally different in ways that completely change what blood pressure numbers mean for your health. Let me break down the three critical changes that happen with aging and why these changes demand different blood pressure targets. First, arterial stiffness. As you get older, your arteries lose their elasticity. Think about a brand new garden hose compared to one that's been sitting in the sun for 20 years. The old hose is rigid, inflexible. Your arteries go through a similar process. When your heart pumps blood into stiff arteries, they can't expand and cushion the pressure, wave, the way young, flexible arteries can. This means you actually need slightly higher baseline pressure to make sure adequate blood flow reaches your brain and kidneys, especially when you're standing upright and blood has to fight against gravity. Second, something called baroreceptor function declines. Baroreceptors are tiny sensors in your blood vessels that detect changes in pressure and instantly signal your brain to make adjustments. When a young person stands up, their baroreceptors detect the pressure drop within milliseconds and trigger compensatory responses. Heart rate speeds up, blood vessels constrict, pressure stabilizes. But these baroreceptors become sluggish with age. They respond more slowly. So, if your baseline blood pressure is already low and your baroreceptors are slow, you get that dangerous drop in pressure when you stand. That's called orthostatic hypotension. Third, your body processes medications differently. Your kidneys and liver don't clear drugs as efficiently at 75 as they did at 45. A dose of blood pressure medication that's perfectly appropriate for a middle-aged person can be way too strong for an older adult. The medication stays in your system longer, has more powerful effects, and can push your blood pressure dangerously low. Now, let me tell you exactly what this recent research discovered, because the specifics are crucial. The study followed over 15,000 adults over the age of 75 for an average of 5 years. These weren't cherry-picked healthy seniors. These were real-world older adults, including people with diabetes, prior strokes, heart disease, and varying degrees of frailty. The researchers tracked their average blood pressure and then monitored what happened to them over those 5 years. They divided participants into groups based on systolic pressure. One group stayed below 120, another was between 120 and 130, another between 130 and 140, another between 140 and 150, and another above 150. Here's what they found. The lowest death rate was in the group with systolic pressure between 130 and 140, not below 120, not the textbook perfect number, the moderate range. Those with pressure below 120 had a 28% increased risk of serious falls that required hospitalization. They had higher rates of acute kidney injury, meaning their kidneys couldn't function properly with the lower pressure, and their overall mortality rate was 14% higher than those in the 130 to 140 range. The group with pressure above 150 also had problems, as you'd expect, higher stroke rates, more heart events, but the surprise was that very low pressure was just as dangerous as very high pressure. The sweet spot, the range linked to longest survival and best quality of life, was higher than what conventional guidelines recommend. Let me paint you a picture. You're 76 years old. You walk into your doctor's office for a regular checkup. Your blood pressure reads 142/84. Your doctor looks concerned, pulls up the guidelines on the computer, and says, "We really need to get this down to at least 130, ideally closer to 120. You're started on a medication. 2 months later, your pressure is 128/78. Your doctor is pleased, but suggests adding a second medication to push it just a bit lower. Another 2 months go by. Your pressure is now 122/76. Perfect, your doctor says. You feel okay at first, but then you start noticing something. When you get up from your chair to answer the phone, you feel momentarily lightheaded. When you stand up from the dinner table, there's a split second where the room seems to tilt. You mention this to your doctor, who says, "It's probably just age-related. Your blood vessels adjusting more slowly. Just stand up gradually. Take your time." But what's actually happening is that your blood pressure, which looks great when you're sitting still in the doctor's office, is dropping dramatically when you stand. From 122/76 sitting down to maybe 95/60 standing up. Your brain is experiencing repeated episodes of inadequate blood flow. You're at high risk for a fall. But nobody's checking for this because your sitting blood pressure looks textbook perfect. This scenario plays out thousands of times every single day across the country. And it's completely preventable if we understand that blood pressure targets need to be individualized based on age and overall health, not applied universally across all age groups. Here's what shocks me. There's a simple test that takes about 3 minutes and can identify whether your blood pressure medications are putting you at serious risk for falls. It's called orthostatic vital sign measurement, and most doctors aren't doing it routinely. So let me teach you how to do this test at home tonight. Because this information is potentially life-saving. You need a home blood pressure monitor. You can get one at any pharmacy for about $30. Here's exactly what to do. Lie down flat on your bed or couch for 5 full minutes. Just rest. After 5 minutes, check your blood pressure while you're still lying down. Write down both numbers, the top number and the bottom number. Now stand up and immediately check your blood pressure again while standing. Don't wait. Check it right away. Write down those numbers. Now compare them. If your systolic blood pressure, that's the top number, dropped by more than 20 points, or if your diastolic, the bottom number, dropped by more than 10 points, you have orthostatic hypotension. This is a major red flag. This means your blood pressure medications may be too strong for you, or your target blood pressure may be too low for your body's actual needs. Even if your sitting or lying blood pressure looks perfect by traditional standards, if it's dropping that much when you stand, you're at significantly increased risk for falls. Let me give you a concrete example. Imagine your lying blood pressure is 125/78. Looks great on paper. But when you stand up, it drops to 98/64. That's a 27-point drop in systolic pressure. That's dangerous. Your brain is getting inadequate blood flow when you're upright, which is most of your waking hours. You might feel fine lying down or sitting, but when you're vertical, you're operating on insufficient pressure. This is the test your doctor should be performing at every single visit if you're over 70 and on blood pressure medications. If they're not doing it, you can do it yourself and bring the results to your next appointment. So what should your blood pressure actually be? I'm going to give you the ranges that research suggests are linked to the best outcomes for different age groups. But understand, these are guidelines, not absolute rules. Your individual target should be determined together with your doctor based on your complete medical picture. For adults aged 65 to 74 who are generally healthy and active with no major medical issues, research suggests a systolic blood pressure range of 130 to 140 is reasonable. This provides heart protection while maintaining adequate blood flow to vital organs. For adults aged 75 to 84 who are relatively healthy, the evidence supports a systolic range of 135 to 145. Notice this is higher than the younger group. This accounts for increased arterial stiffness and slower responses to pressure changes. For adults over 85, or for those who are frail regardless of age, a systolic range of 140 to 150 may be most appropriate. At this stage, preventing falls and maintaining quality of life often takes priority over aggressively lowering blood pressure. Now, what about the bottom number, diastolic pressure? For older adults, diastolic should generally stay above 65, ideally between 70 and 85. Very low diastolic pressure reduces blood flow to the heart muscle and can cause serious problems. If your diastolic is consistently below 60, that's something to discuss with your doctor, even if your systolic looks fine. Let me give you a real-world example. Imagine someone who's 73 with type 2 diabetes and a history of one heart attack 5 years ago. Their blood pressure is 148/86. Should they aim for 120/80? Probably not. Should they aim for 150/90? Also, probably not. For someone in this situation, research suggests a target around 130 to 135 systolic might be optimal, low enough to provide heart protection given the diabetes and cardiac history, but not so low that there's risk for drops in pressure when standing and potential falls. The key is that this target should be reached gradually, with careful monitoring for side effects every time a medication is adjusted. Orthostatic blood pressure should be checked. Symptoms matter: dizziness, fatigue, foggy thinking. These might indicate that pressure is being lowered too much, even if the numbers look good on paper. And here's something most people don't realize. Blood pressure varies throughout the day. One reading of 148 over 86 doesn't mean pressure is always that high. It might be 132 over 78 in the morning and 145 over 84 in the evening. What matters is the average over time. That's why home blood pressure monitoring is so valuable. It gives you a much more accurate picture of your true average pressure than occasional readings in the doctor's office. You might be wondering, if this research exists, why hasn't your doctor mentioned it? Why aren't blood pressure guidelines for seniors different? The answer is complicated, but it comes down to how slowly medical practice changes and how guidelines get created. Most blood pressure guidelines are based on large clinical trials conducted over many years. The landmark trials that established 120 over 80 as the ideal target were done primarily in middle-aged adults. When those results came out, the guidelines were applied broadly across all age groups. There was an assumption that what's good for a 50-year-old must also be good for an 80-year-old. But over the past decade, researchers have started looking specifically at older populations, and they're finding that one size absolutely does not fit all. The problem is that it takes years for new research to filter into clinical guidelines, and even longer for those guidelines to change everyday clinical practice. Many doctors are still operating based on guidelines published 5 or 10 years ago. They haven't seen the recent research suggesting that moderate blood pressure elevation is actually safer for very old adults. Let me show you how different two people the same age can be. Both are 81 years old, but their situations couldn't be more different. The first person is living independently but managing some chronic conditions. Mild heart failure, chronic kidney disease, stage 3. Osteoarthritis, blood pressure is 158 over 88. The doctor wants to start aggressive treatment to get it below 130. The second person is also 81, but they're healthy, active, play golf twice a week, no significant medical problems. Their blood pressure is also 158 over 88. Same number, same age, but completely different risk profiles. For the first person with multiple conditions, starting several blood pressure medications carries significant risks. Those drugs could lower pressure too much, especially when standing. They could worsen kidney function. They could cause dizziness and increase fall risk, which, with osteoarthritis, could be catastrophic. A more reasonable approach might be lifestyle changes first. Then, if medications are necessary, a low dose of one drug with careful monitoring. Accepting a target of maybe 140 to 145 systolic, rather than pushing aggressively toward 130. For the second person, the healthy 81-year-old, 158 over 88 might warrant treatment, but again, not aggressive treatment. Perhaps lifestyle changes could bring it down to 145 over 84, which for a healthy person that age might be perfectly acceptable without medications at all. Same numbers, different people, different approaches. This is called treating the patient, not just the number. Let me give you specific, concrete action steps you can implement starting tonight. First, if you're over 70 and on blood pressure medications, get a home blood pressure monitor if you don't already have one. Check your pressure at the same time each day for 2 weeks, morning and evening. Keep a written log. This gives you an accurate average and helps you see patterns. Second, perform the orthostatic blood pressure test I described. Lie down for 5 minutes, check pressure, then stand and check immediately. If you have a drop of more than 20 points systolic or 10 points diastolic, write that down to discuss with your doctor. Third, assess your symptoms honestly. Are you experiencing dizziness when you stand? Unexplained fatigue? Difficulty concentrating? These might be signs your blood pressure is too low, even if the numbers look fine. Fourth, schedule an appointment with your doctor specifically to discuss your blood pressure targets. Don't just accept a blanket statement that you need to be at 120 over 80. Ask what target is appropriate given your age, your other medical conditions, and your overall health. Bring your home blood pressure log. Bring your orthostatic measurements if you found a significant drop. Have an informed conversation. Fifth, if you're experiencing side effects from blood pressure medications, speak up. Don't suffer in silence. Many people assume that feeling dizzy or tired on medications is just something they have to live with, but often doses can be adjusted, medications can be changed, or targets can be modified to improve your quality of life while still providing protection. Here's what you now know that most people, including many healthcare providers, don't fully understand. Blood pressure targets should not be universal. A 45-year-old and an 85-year-old should not be held to the same standard. For older adults, especially those over 75, systolic blood pressure in the range of 130 to 145 is associated with the longest survival and best quality of life. Lower than 120 increases risk of falls, drops in pressure when standing, kidney injury, and possibly cognitive decline. Higher than 150 increases heart and stroke risk. The sweet spot is in the middle. You've learned that orthostatic hypotension, that drop in blood pressure when you stand, is often more dangerous than moderately elevated sitting blood pressure. You've learned how to test for it at home. You've learned the reasons why seniors need different targets. Stiffer arteries, slower responses to pressure changes, different medication metabolism. Most importantly, you now have the language and the knowledge to have an informed conversation with your doctor. You're not just passively receiving medical advice. You're an informed participant in your own care, and that's empowering. Drop a comment right now saying informed if this gave you clarity, if it answered questions you've been wondering about. Share this video with friends or family members over 65 who might benefit. Subscribe to this channel because my mission is bringing you research-based health information that's accessible, practical, and potentially life-changing. This information is for educational purposes only and is not intended as medical advice. Blood pressure management should be individualized. Never adjust or stop medications without consulting your healthcare provider. Always work with a qualified professional before making changes to your treatment.